Okay, folks, so this is part two of working with neck spasms. Basically using the L5-S1 segment and the thoracic spine to release these acute spasms. So as a quick review, the reason why you're doing this is that the person has locked or compressed thoracic spine, and I say that in quotation marks, and also locked, compressed L5-S1. In other words, those segments aren't moving. Remember, there has to be some motion that occurs at those segments. Otherwise, other segments above and below have to compensate for that lack of motion. So in this instance, because the thoracic spine is locked, there's going to be more excessive motion of the cervical spine, adding more load to the cervical spine, potentially causing muscles to spasm in the area. So in other words, this is more of a chronic issue if you look at it from a deeper perspective as opposed to just working into the neck. So I want to add also that this is not a treatment video per se. This is sort of giving you an idea, a mindset in terms of how to work with a particular person with this type of presentation that comes in. So we're not ignoring working locally on the neck. What we're doing is we're basically working on this person prone, getting an idea that there's some issues with the thoracic spine, there's some issues with the L5-S1 segment, and by working with those issues, we can help deliver a better treatment long term for the person. Treatment result. So I'm going to go to Skelly here. You see Skelly's lying on his stomach. He's lying prone, and we're going to go straight into the techniques basically. So what you're going to do is you're going to have this person, after you've done all the assessments and basically you've done the health history, the questioning, so on and so forth, this person's going to be lying prone. What you're going to do is you're going to take your right hand if you're on the right side, left hand if you're on the left side. You're going to place it on the sacrum as such. And what you're going to do is you're going to basically traction L5-S1 by pushing lightly, very lightly, a couple of, maybe less than a pound of pressure towards the feet. And what you're going to find is you're going to basically notice that there should be a bit of a gap that occurs between L5-S1. You'll notice a bit of a motion that occurs with the sacrum. Okay, so you're going to check that. Next, you're going to see how much gapping there is between each segment of the thoracic spine. So by doing that, to do that, you're going to basically find the difference spaces between each spinous process with your fingers, place them there, and you're going to first check to see like how much space there is. Then you're going to place your palm, your right palm again, on the sacrum, and you're going to do another tractioning technique here, very lightly, and you should notice that there's a bit more space in between each spinous process. Some of the processes might have more of a gap than others. By the way, this can also be used not only as just an assessment technique, but it can also traction, it can also be part of your treatment in that it can help stretch the little muscles such as the rotatories, multifidus, and semispinalis of the spine. So again, pushing down, checking the spaces, you're going to see if there's much of a gapping there. So after that, you're going to do, you're going to check to see how much motion there is of the thoracic spine anteriorly. In other words, towards the table. You're going to place your hand, your palm, doesn't matter left or right, and you can just push lightly into the table, right? Maybe a pound, less than a pound, and you're going to go segment to segment or section to section, and you will notice that there will be some give of some of the thoracic spine segments relative to the other. Maybe the whole thing is locked. You won't notice much of a give, but there should be. In normal, you'll notice that people that don't necessarily have issues with their thoracic spine will have better motion anteriorly of each segment. Okay, so you're doing this without placing your palm on the sacrum. Next phase, you're going to take your palm, your right palm, and you're going to push again towards the table. You're going to do a bit more of a traction. And what you're going to do is you're going to push the thoracic spine segments towards the table, and by tractioning, what happens is you're actually opening up a bit more space, and it allows more of a anterior motion of the thoracic spine. So you should notice more of a give as you're tractioning the sacrum on L5. Okay. Next phase, finally, is you're going to do, you're going to check to see how much the thoracic spine moves laterally. And by so doing, what you're going to do is you're going to take your fingers, your thumb and your index finger here, and you're going to grasp onto sections of the thoracic spine. You're going to actually segments of the thoracic spine via their spinous processes. You're going to pinch it, and you're basically going to wiggle it. So it's a bit of a joint play there. You're going to wiggle it side to side, and you should notice a bit of a give If not, it's probably locked. Then after you've done that, you're going to place your palm again on the sacrum. Take your left hand, pinch the spinous processes of each segment and wiggle it side to side. So you're doing this action here. And because, again, you're gapping the areas up around the thoracic spine via tractioning, using the traction technique. Because remember, it's not only the L5-S1 that you're gapping up, there's actually, the entire spine is actually being tractioned. As light as the technique is, you should notice more of a gapping that occurs, more of a motion anteriorly and more of a motion laterally as you're doing the sacral technique here. Okay, once that's done, you're going to work on the muscles. You can do your relaxation techniques on the muscles to soften it up. Then you're going to repeat. Check L5-S1 via the traction of the sacrum here. You're going to check the gapping of each spinous process of the thoracic spine via, again, the sacral technique. Then you're going to check to see how much anterior motion there is of the thoracic spine. And then finally, you're going to check to see the lateral motion of the spinous processes to assess how much motion there is side to side. So if you're doing this correctly, after a couple of times, you should notice more of a give of the thoracic spine and also better motion of the L5-S1 segment. When you're comfortable with the way that the spine is moving, what you're going to do is you're going to ask the patient to lie supine. Then you're going to work directly on the neck. And you should notice, if you palpated before this, that some of the neck muscles should be more relaxed. The person should be able to rotate. So when you flip them supine, ask them to do a rotation of the cervical spine slowly, and they should notice more of a difference in terms of the way their neck moves. And the reason for that is you're getting more motion around thoracic spine, more motion around L5-S1. Therefore, there isn't as much motion needed around the cervical spine, and therefore less spasm. So, as I said, if you do it correctly, this technique, you'll notice those changes. The rotation should be a lot better. The person should feel less discomfort around the neck. So let me reiterate, this is these techniques would be used with somebody that has a predisposition to basically locked thoracic spine and locked L5-S1. And via your questioning, you should know, you should get an understanding whether this person is that type of person to use these techniques on. So I'm hoping this helps. If you got questions, feel free to message me. You can email me at admin@ventepainrelief.ca. Give me some feedback if you're using this. Tell me like how it's worked for you. Next week we will do I'll have a video, my first video on fascia. I love fascia. Fascia is the basis of my work. And I call this the C7 fascial distortion with T pattern of the upper body. This is a presentation for somebody that has very, very, very tight neck and shoulder muscles, upper traps. Regardless of how much you do, in terms of muscle manipulation, it doesn't seem to be giving. This is an awesome way to get those areas to release. Watch us next week, Tuesday, again at 12 Eastern for our premiere. And also watch for our announcements, listen for our announcements for upcoming courses. This is Alfie again at Vente Pain Relief Clinic. Have yourself a great day. Take care.